Welcome to ASEAN MedTech Insights. Here's your weekly update for the fourth week of March 2026. The big news last week came from Hanoi, as Vietnam's Ministry of Health announced the nation's full and immediate implementation of the ASEAN Medical Device Directive, or AMDD. This move completes a multi-year transition and signals a pivotal shift in the region's regulatory landscape. For years, medical device companies have viewed ASEAN not as a single market, but as 10 separate complex puzzles. A product approved in Singapore required a completely different technical dossier, language, and submission process for Vietnam. This fragmentation created significant delays and drove up costs, making the region a lower priority for many global medtech innovators. Vietnam's decision to fully adopt the AMDD and its Common Submission Dossier Template, the CSDT, changes the game entirely. Now, the technical file approved by Singapore's HSA can be used as the core of the submission for Vietnam, drastically simplifying the process. Let's consider a real-world example. A Malaysian scale-up specializing in remote cardiac monitoring devices recently gained approval in their home country. Their original plan for Vietnam involved a projected 18-month timeline, including complete document translation and reformatting, plus significant consultancy fees. With this new alignment, they can leverage their existing CSDT. Their regulatory team now projects they can secure approval in Vietnam within 6 months, cutting their time to market by a full year. This is not just about paperwork. It is about accelerating access to critical healthcare technology. This development also puts strategic pressure on other nations like the Philippines and Indonesia, who are still in the process of full harmonization. Vietnam's move creates a powerful economic incentive for them to accelerate their own adoption to avoid being left behind. We are witnessing the slow but steady birth of a truly unified ASEAN medtech market. This harmonization lowers regulatory risk, which is a key factor for venture capital and strategic investors looking at the region. A clear, predictable, and harmonized pathway into a market of over 680 million people is an incredibly attractive proposition. For any medtech companies looking to navigate these evolving regulations and capitalize on the opportunities in ASEAN, understanding these details is critical. If you have questions about how to adapt your own regulatory strategy, you can email or visit Pure Global.